Hi, everyone. It's been 10 years since we started RadEdAsia, and I thought it's probably time to do a new introductory video because a lot of things have changed in that time. If you haven't heard of us before, we provide learning in MRI, particularly MSK MRI and spine MRI. And our aim is really to make you much more confident in assessing a scan and being able to find the abnormalities and then putting out a report that makes sense and is very well respected by clinicians. And if you're a clinician, to be able to look at the scans for yourself and correlate that with the clinical findings that you're seeing. We've had people from many clinical fields join our courses, from radiologists to pain physicians, orthopedic surgeons, neurologists, physiotherapists, rheumatologists, really anyone who's got an interest in imaging and uses that in their clinical day-to-day practice. And the way we teach is different to most of the other ways that you'll find. We provide guided learning, and I think that is incredibly important when you're trying to learn these things. You need the ability to be able to ask questions. You need someone to guide you in your learning. And if you don't have that, you're really just left with an online course or looking at PowerPoints at a meeting and not really being able to get into the depth of things and not being able to clear your doubts. So that for us is where we start. We start with it being guided. Our aim for you at the end of any of the courses that we do is that you should be able to look at a scan, know where to look, know what to look for, and if you're a radiologist, how to report it, or if you're a clinician, to be able to interpret that scan for yourself and tie that up with your clinical findings. It's a very practical-based learning. So the teaching itself, how is it done? We have DICOMs, and I think that's important that you're able to actually scroll through images and find the abnormalities for yourself rather than just have someone point it out to you on a PowerPoint or a slide. And with those DICOMs are videos that explain where to find those abnormalities so that you can then go and actually find those abnormalities for yourself. And that reproduces the way that we do things at work. Apart from the videos and DICOMs, we have plenty of images, which are all annotated and explained. There's text, which gives you a lot of background information. And there's a large section of question and answers. There are lots of comments people make about difficulties they're having interpreting the scans, and there are answers for it. And these are very useful. People find this a very important part of their learning because they can see what others are asking and learn from that as well. Currently, we have 10 courses in spine and MSK MRI imaging, and we are progressively adding more and more. So if this is something that you think would be useful for you in your day-to-day practice so that you can become much more confident in reporting, then we'd be very happy to see you in one of our courses, and we look forward to seeing you.